Hi, I'm Dr. Mayur Shetty. I'm a board certified plastic surgeon at Skinspire Clinic. Today, we are going to talk to you about a very underrated anti-aging procedure, and that is blepharoplasty or eyelid rejuvenation. A blepharoplasty is one of those cosmetic procedures which gives both cosmetic as well as functional benefits, and the results can be very subtle, natural, and transformative. So let's start with the basics. First of all, blepharoplasty is a surgical procedure. It removes and it repositions. What does it remove and what does it reposition? This can be excess skin, muscle, or fat that prolapses out with age. A blepharoplasty is done for three main reasons. One is to remove the excess skin that is sagging over time. It tightens the skin. The second is to get rid of those eye bags that you develop as a result of aging. This is basically fat that is protruding out. And the third most important reason is, as a result of loosening of the skin, as a result of sagging, there is some amount of decrease in the aperture of the eye, and this causes some kind of obstruction of the vision. Blepharoplasty reverses all these changes with aging. So what is the goal of a blepharoplasty? The goal is to give you a more youthful, rested, and brighter appearance, a more refreshed look that is most importantly natural. So how do you know if you are a candidate for blepharoplasty? These are the following points I look for during a consultation. The most common concern that a patient comes with is that I look tired and dull throughout the day. A patient requiring a blepharoplasty may have excess skin in the upper eyelid, which is causing drooping of the eyelid. A very common concern is the eye bags, which is basically because of the fat that is prolapsing out from underneath the eyes. The other most common concern is that there is a lot of hollowness and loss of volume around the eyes. This can be also associated with dark circles. All of this is because of the age-related changes that happen around the eye. What I have noticed in my practice is that age-related changes, especially around the eyes, is occurring a little earlier. Before, we used to see patients at the age of 40 to 50 years having these age-related changes. But now we see people in their late 20s and early 30s with loss of volume, eye bags, as well as sagging skin, giving them a very dull and aged look. So there are two main types of blepharoplasty, and most often I do both of them together. It's an upper lid as well as lower lid blepharoplasty. In an upper lid blepharoplasty, what I do is I remove the excess skin so that the stitched line falls in the natural skin crease that is present in the upper lid. For a lower eyelid blepharoplasty, I do something called as a transconjunctival blepharoplasty. So here the incision is within the eyelid, so there are no external scars. I remove those excess fat pads which are present and prolapsing out, as well as tighten the skin. Most of my patients undergoing blepharoplasty also undergo fat grafting. Fat is taken either from the abdomen or from the thighs. It is converted into a liquid form and injected into the areas where there is volume loss. Now let's talk about the procedure. The procedure is done under general anesthesia or under local anesthesia with a slight amount of sedation. The procedure takes about 1 to 2 hours, and the stitches that I use are very fine sutures, almost as thin as your hair. The stitches used in blepharoplasty are very fine, and the incision is planned in such a way that it always falls in the natural creases of the skin. Let's talk about recovery. For the first few days, that's about 5 to 7 days, you will have some amount of swelling as well as bruising all around the eyes. This decreases over a period of 7 to 10 days. Otherwise, you are not restricted in doing your daily activities. It is just that you will have some amount of social restriction because of the swelling and the bruising. When it comes to pain, prescription painkillers are sufficient, and most of my patients need to take it only for up to 3 days after the surgery. When can I see my final result? Your result is visible to you after 7 to 10 days of the procedure. This is when the swelling and the bruising completely comes down. However, the results keep getting better over time, and a final result is usually seen within 3 months. Most of my patients after a blepharoplasty can perform their daily activities almost immediately. However, when it comes to getting back to your work, about 7 to 10 days of recovery is required. Let me talk about a few common myths about blepharoplasty. The first commonly asked myth is, will it look fake? Now, a blepharoplasty is done to reverse the signs of aging. So, the incisions we place and the kind of reversal or repositioning that we do is to give you a very subtle transformation, but a natural look. Is it painful? Blepharoplasty causes minimal discomfort, which can be taken off with just prescription painkillers. Most of my patients need to take painkillers only for a period of 2 to 3 days after the procedure. Most patients ask me, does blepharoplasty affect my vision? Yes, the surgery is close to your eye, but all our incisions and the procedure is done on the skin, the muscle, and the fat within the eyelids. We do not go close to the eye. So your eye and your vision is not affected. However, most patients do say that their vision is improved after a blepharoplasty. This is because the loose skin that's causing the eyelid to droop is completely tightened, so their vision is actually improved after a surgery. The next most commonly asked question is, will there be scars? An upper blepharoplasty is planned in such a way that the incision falls within your natural skin crease in the upper eyelid. The stitches are extremely thin, so there will be no telltale signs of a surgery being done even after the stitches are removed. A lower blepharoplasty, what I do is a transconjunctival incision, which means that there are no external cuts. Everything is from within the eyelid, so nothing is visible externally. Blepharoplasty is generally safe, but it's not for everyone. You might not be a candidate for blepharoplasty if you have any other systemic condition that's causing puffiness in the eye. This can be thyroid-related issues, or even something related to hypertension, or even kidney-related issues. The most important reason why you shouldn't get a blepharoplasty or any cosmetic procedure is if your expectations are unrealistic. So if you think that you are a candidate for blepharoplasty, then have that consultation wherein we discuss the medical suitability as well as we discuss expectations and what we can achieve. Blepharoplasty is a very precise procedure. It's a very transformative procedure, and the most important thing is that when it's done right, it gives you a very natural looking result. Thanks for watching, and don't forget to like, share and subscribe to our channel.